Well, whooping cough is on the rise in the U.S., and the CDC says protection from the vaccine is waning. So far, there have been around 14,000 cases reported nationwide this year. And here in Pennsylvania, the state recorded over 2,000 cases of the infection this year. That is 10 times the number seen at this point last year, and the highest in any single state or territory nationally, according to the CDC. I'm joined now by Dr. Banku Jareth, a pediatrician at Penn State Health Children's Hospital. Dr. Jareth, thank you so much for being here. We appreciate it.
It's a pleasure being here. Thank you.
So give us an idea first. We'll start with a general question. What is whooping cough?
So whooping cough, also called as pertussis, was also called a 100-day cough, is caused by a bacteria called as Bordetella pertussis. It is a highly contagious respiratory illness that can initially look very much similar to common cold. The first 2 weeks are just common cold with cough, congestion, some runny nose, and no fevers or mild fever. And it can be very easily confused with just flu or common cold. It is the second phase, which is the paroxysmal phase, that is the giveaway for whooping cough, where patients then start presenting with worsening of the cough, followed by coughing fits and cough that is ending with a whoop, which is a very high-pitched noise that you hear at the at inhalation when the patient is trying to breathe deeply in after a coughing fit. So yes, and it is not a common cold cough. It can have a very serious complications, especially in infants and people or elderly with some chronic issues, health issues as well.
So I mentioned in the intro to this that we've seen increases across the country, and we've seen significant increases here in Pennsylvania. So what are we seeing? What are you seeing here at Penn State Health? What are we seeing here in the Susquehanna Valley?
So fortunately, we have not, especially in our clinic, we have not seen any cases of the whooping cough yet. But there have been a large increase in cases in other counties. And definitely in Pennsylvania, we are leading the nation with over 2,000 cases of whooping cough this year.
So what can parents do to try to prevent it? Is there any way to do that?
Yeah, vaccine is the best answer to that. Getting, your kids vaccinated. If you're a grandparent, taking care of, your grandkids, getting yourself vaccinated with boosters is the best answer. And also taking precautions. The reason why we were not seeing those many cases during the COVID pandemic was because we were very rigorously following measures to prevent, spread of respiratory viral infections, primarily COVID, with social distancing, hand hygiene, and all that stuff. And I think that is what was keeping the other bacteria and respiratory viruses at bay as well.
And you mentioned there right away about the vaccine, a great way to help prevent it, hopefully. When should people get vaccinated for whooping cough?
So for babies, the vaccination series starts at 6 weeks. So from 6 weeks to 4 to 6 years of age, they need to get 5 doses of the Tdap vaccine. And then at 11, you get your first booster with the Tdap. And then every 10 years, you get boosted with the Tdap. For pregnant ladies as well, we do recommend getting them vaccinated anywhere in their third trimester, between 27 to 36 weeks. That also provides some passive immunity to the baby who cannot be vaccinated till they are 6 weeks of age.
All right, Dr. Banku Jareth joining us today. Thank you so much. We appreciate all the information.
Thank you so much.